Are you a physical therapist or chiropractor that's, just getting that insurance crunch? We're going to talk today about how to market and add cash-based services to your practice, how to do it almost risk-free, how to quickly fill up your office and start a recurring revenue without adding any extra team members. I've got Stan from Stimpod. Stan, say hi.
Hey, Ian. Nice to be here.
And of course, this is brought to you by videocasestory.com. As we'll talk about, one of the things you'll definitely want to collect are amazing video case stories. We'll tell you exactly which ones to collect, where if you go to videocasestory.com/finder. All right, let's get started.
My name is Gino Wickman. I was introduced to Ian, and that's what brought me into this video world and got me embracing this video world. And Ian did exactly what I hoped. He got me really comfortable with putting videos out to the world and having a great strategy around putting videos out to the world, because there's so much more than just shooting a video. And so the way that he positions those videos, optimizes those videos, he's done a great job.
All right. And Stan, tell us a little bit about what Stimpods is, first of all.
Yeah, so Stimpod is a handheld FDA-cleared device that, in essence, it helps reboot the nerves. We live in a complex day and age where a lot of people are in pain, whether it's mental pain, anxiety, or whether it's physical pain. One of the key indications that we work with is if you know anybody that's diabetic. For instance, the diabetic population in this country, no pun intended, it's an ever-growing patient population. It's out of control. And unfortunately, when you develop diabetes, a lot of the times you are going to develop neuropathy. So it's then referred to as diabetic peripheral neuropathy. You may have numbness, pain, tingling in your feet. You'll end up with balance problems. You'll be a fall risk, all of which are really bad problems. In addition, just your quality of life. You may have difficulty sleeping. You may have difficulty doing the things that you enjoy doing. And historically, these patients have gone to their primary care provider, who in turn has referred them to an endocrinologist to help deal with their diabetes, who in turn has referred them to a neurologist, all of whom have pretty much told the same story, which is something to the effect of, sorry, Bob, but I've got nothing for you. They end up putting him on gabapentin or Lyrica or Cymbalta as a way of helping to manage some of the symptoms, but they're really not doing anything at all about the underlying nerve damage. The best analogy I can give you, that's like driving your car down the highway. The check engine light comes on. You take out a piece of black tape and you cover up the check engine light. You haven't done anything to potentially fix the problem. You've just kind of made it so you're not looking at it. That's what the pharmaceuticals are doing with diabetic neuropathy. They're really not addressing the underlying nerve damage. That's what Stimpod does. We actually help with the underlying nerve damage. It's funny, there's a great doctor up in Toronto that we work with. He's in his late 70s. He's an MD, okay? He's also a world-renowned acupuncturist. So he's kind of this beautiful blend of traditional Western medicine and Oriental medicine. He learned about Stimpod a little over a year and a half ago, and to use his words, he said, Stimpod has revolutionized how I now practice medicine. And that's coming from an MD who's been practicing for a very, very long time. And he gives me a couple of great analogies, one of which is, let's pretend you're having a bad day with your computer, okay? It's running slow, it's freezing. You get so frustrated that you finally pick up the phone and you call tech support. What's the very first thing they're going to tell you to do?
Turn it on and off.
Exactly. Let's reboot your computer, sir. unplug your modem, restart your router. In essence, that's what Stimpod is doing for the impacted nerves. We're trying to reset that nerve or those nerves so they get as close to normal as we can get them.
That's amazing. And so, when someone is adding something like Stimpod onto a practice, I think a lot of people just think, because I've seen this before in chiropractors, PTs, and pretty much any expert. They're like, hey, I'm going to add this new thing on, and it's just going to make me, it's going to help everyone. It's going to be so awesome. And because it helps everyone, it's just going to naturally sell itself. But that's not usually the case, is it?
Right. No. And usually what ends up happening is that fancy new piece of equipment, especially for some of the clinics that have multiple practitioners and multiple staff, it's like the staff goes, especially when it happens after the doctor was just at a medical conference. It's like, okay, what did he buy now? That we're supposed to start using, he got sold a bill of goods. So we kind of do it the other way around. First of all, a lot of our clinics will get them encouragement to start doing workshops. Okay. Workshop presents you as the local expert. And let's just, for argument's sake, let's take this diabetic neuropathy population. It's a huge patient population. And they're really frustrated because some of them for years have been told by the 3 doctors we were talking about that there's nothing that can be done. Now, all of a sudden, on their social feed, they start seeing videos with you as this local doctor who has expertise in being able to help with the symptoms of their neuropathy. And all of a sudden, you tell them, okay, that Saturday at 11 o'clock, you're going to be doing a workshop. And you market to get that workshop. And maybe you have 10 people at that workshop. Maybe you have 15 or 20 people at that workshop. The great part about Stimpod is when we're treating diabetic neuropathy, there's just 2 locations on the leg that we're going to treat. One of them is the common peroneal nerve, which is right at the top of the fibular head behind your knee. The instant we locate that common peroneal nerve, their foot starts to dance. Their foot starts to go like this. All of a sudden, that patient who hasn't had a lot of sensation in their legs, perhaps in years, sees and feels this. They instantly know this doctor is onto something because they're feeling it. Their foot is reacting to it. So the great part about doing these workshops, when a new clinic comes on board and they get one of our packages, part of our package, we literally fly one of our doctors to their clinic for what I call a fabulous Friday. Usually the doctor that we use, he's outside of New York City. He is in his clinic Monday through Thursday. Thursday night, I put him on a flight somewhere to one of the new clinics that just came on board. He spends all day Friday at their clinic doing additional hands-on training with their staff. Okay, we've already trained the staff just like this, via Zoom, and we'll have you up and running in half an hour, really confident and competent with Stimpod for a lot of the treatments that you'll be doing for the ailments that come into your office every day. But for this fabulous Friday, our doctor is in your office. We encourage you, schedule 10 or 15 of your most complex cases to come into the office that morning while our doctor is there with you. He'll help you diagnose, he'll help you treat, he'll help you get them sold on treatment package. Then do a workshop. Okay. So we did that in the morning. We helped additional training for staff. We help treat individual complex cases. Let's say 1 o'clock, you do a diabetic neuropathy workshop with 10 or 15 potential patients there. You are going to close most of them to come on board because the moment they feel Stimpod on their leg, they know this is something different. Then we encourage you, bring in more people, because usually the workshop's an hour and a half or so. Bring in more of your complex cases in the afternoon, and then schedule a second workshop for 6 o'clock that night, because you'll have a lot of potential patients who perhaps are still working. They can't get there for 1 o'clock, but you can bet they'll be there for the 6 o'clock. And typically, as a result of this one day with our doctor in your office, you really scheduled enough people and you've pitched enough programs to pretty much pay for the entire Stimpod package. So we make it, we've got great financing available. We do great training. And in fact, we put what I call our ultra success guarantee on our product. We make the statement that if you don't collect at least 10 times your investment in the first 12 months, I will buy back your Stimpods. So we make it really hard for somebody to say no.
That's amazing. That's amazing. And I want to unpack what you did there, because I think a lot of chiropractors, a lot of PTs have done workshops. Like, well, the workshop doesn't work, because really what they're doing is like a dinner that's a disguised sales pitch. And while you are pitching, they're actually experiencing, right? You're bringing people in and they're experiencing this. Now, the people coming to the workshop, are they paying to come to the workshop?
No. Again, the doctor can do what they want. We encourage them, make the workshop free, okay? Make the workshop targeted so that it is people with diabetes, okay, they don't need to know, because a lot of times they know the symptoms, okay? They know, yeah, that sounds like me. I've got tingling in my feet. I've got some numbness. I've got some pain. They may not know technically that is diabetic peripheral neuropathy, but they know if they're diabetic or they're pre-diabetic. And while we can also help with chemo-induced neuropathy, and then there's what's called idiopathic neuropathy, when they don't know the true cause of the neuropathy, but patients know that they have it. And so typically when they're marketing, they're not marketing for a specific medical condition. They're marketing for, if you know somebody who's suffering with diabetes, who has numbness and tingling in their feet and legs, they may be suffering with neuropathy. We've got new technology that can really help. And then really play up the fact that we've got this doctor flying in from New York who's going to be here on Friday, and we only have a limited number of seats available. That way you've developed scarcity, you've developed authority, you've developed trust, all the things that you really want to do. Because you're right, there's a lot of, and I won't pick on chiropractors, there's a lot of medical professionals who didn't get a lot of marketing training in med school. Okay, they didn't. They learned how to adjust, they learned how to treat, but they didn't really learn the business aspects of it. So we help them, with that. We help them get patients. And the other thing we really encourage is, you've got a database of previous patients. Let's also market to that database. And let's not talk about, are you suffering with? Started with, do you know somebody who's suffering with? Because maybe it's their spouse, maybe it's their parent, maybe it's their aunt or uncle. So we want to expand that horizon.
Oh, that's a great idea, because, you're taking care of it word of mouth, right? And everyone wants to help someone they know. And if they've had this, they most likely have talked to someone who has it too. That's right. So smart. That's so smart, because you're using almost like a case story within a case story and expanding it out. Right. And I think the key too is, once someone comes in, you have to have some sort of device to keep them on as patients. So tell me a little bit about that.
Yeah. So the device itself, so that one. So it's a little handheld device. Okay. It's FDA cleared. For those of you, which most of us used to have an iPod back in the day. That's how we actually adjust the level. Okay.
Yeah.
We're spinning our finger around the flywheel to increase or reduce the intensity. And with Stimpod, we're locating the nerve or the nerves that are impacted. And so far we've been talking, about peripheral neuropathy. The fact is, from head to toe, there are hundreds of treatments that you can do with Stimpod, ranging from migraines, trigeminal neuralgia, TMJ, Bell's palsy, radiculopathy, frozen shoulder, tennis elbow, pickleball elbow, any type of pain. Do you know anybody yourself who had shingles?
I don't, I think I know a few people, but it's been a while. I don't remember off the top of my head.
Especially with the older population, a lot of them will develop shingles. Really painful rash. Ultimately, the rash resolves. A lot of times they will then end up with what's called post-herpetic neuralgia, which basically means pain. And there are times that you may have had the rash over here, but now you may have this post-herpetic neuralgia all up through here. Literally, you cannot touch that area. Case in point, there's this one patient of the doctor I was mentioning before, who's the MD/acupuncturist. This lady was in her early 80s. For the past 2 years, has not been able to wear any clothing up here or touch anything up here. Her son had taken her to every type of medical professional he could find. Nobody had been able to help resolve her pain. They finally found this doctor. Doctor says, great, have a seat. Now he's using the Stimpod as a pain eraser because there's a little stylus. And with the stylus, you're holding it on a nerve. Well, in the case of post-herpetic neuralgia, you're kind of painting the area. So literally for 5 minutes, the doctor is going like this. And he goes, okay, try it now. And you see this video. She goes like this. She starts crying. These are happy tears. She goes, I don't feel it. This is the first time in 2 years I don't feel it. Then she moves her hand up a little bit higher and you see her wince. She goes, well, we're not done. We just started on this area. But yeah, so Stimpod is not just for neuropathy. It's any type of pain or nerve related issues. And if we locate the nerve, we can help reboot that nerve.
And so, well, let's talk a little bit about making sure, obviously you're getting results and you need to have something that gets results, but how are you making sure that, this is a continuously profitable? How are you helping, what's the methodology to make sure that, there's, you have patients coming back using it, yep. And also that you don't have to, grow a big staff to do this.
Yeah. The nice part is part of the protocol can actually be the patient taking one of your Stimpods home with them, because there's another treatment that's called, have you ever heard of the vagus nerve?
Yep.
Okay. Many people have maybe heard the word, but have no clue what it is and how significant it is. It turns out the vagus nerve is the longest cranial nerve in your body. The vagus nerve connects every one of your organs. So everything from blinking to breathing to heart rate to digestion to anxiety, all of that flows through the vagus nerve. We live in a really complex world right now. A lot of people are anxious between the stock market, politics, whatever is going on, pain. They may be on pain meds. They're really jacked up. They're hyper, or they just really are suffering. The vagus nerve, stick your finger in your left ear.
I can't. I've got an ear pod in.
All right. Well, if you stick your finger in your left ear, that's not where the vagus nerve is. But if you raise it up above that, there's a little pocket there that's called the cymba concha. That's where the vagus nerve terminates. So literally for 10 minutes, you have the patient lie down in ideally the most comfortable recliner that you have in the office or on a treatment table. For 10 minutes, the patient is going to hold the Stimpod in that left ear. The instructions are, okay, Betty, I want you to close your eyes. I want you to breathe in through your nose, out through your mouth. I want you to forget about the rest of the world. I want you to become a master meditator. Clinically, what you will notice at the end of those 10 minutes, her pupils are dilated. She is incredibly relaxed. It also activates what's called the cholinergic anti-inflammatory pathway. Complex way of saying it helps the body heal. It helps the body reduce inflammation. It's actually an FDA cleared treatment for anxiety, for depression, for epilepsy. It's remarkable. People love doing vagal stim. And once they start doing it, you will have some patients who will say, hey, can I rent this? Can I take this home? Because the ideal frequency to do vagal stim is twice a day, 10 minutes in the morning, 10 minutes in the evening. And you'll have patients, especially some of those chronic pain patients, perhaps patients with fibromyalgia or CRPS, who would thrive by being able to do vagal stim twice a day. So a lot of clinics will rent Stimpods for typically about $500 a week, and they'll rent it for a couple of weeks at a time. And when you do the ROI, you discover, it's funny, our little slogan is, your patients will be grateful, your CPA will be amazed. You get an amazing ROI on your investment.
That's fantastic. And so tell me a little about getting started. How do you do this with working with you?
So basically you just go to my website, which is the stimpod10.com. You set up a Zoom. You know, I do Zooms like this all day long with patients. It's funny. I'll tell you one story. We like to go cruising. So it was August. We were on a cruise ship up in Alaska, and I've got my laptop set up on the balcony. I'm on a Zoom with this doctor. First of all, he accuses me of green screen. I go, no, this is legit. That really is the glacier. I'm up in Alaska on a cruise ship. So we're getting along really well. And just to show that there are other things that we treat, this doctor says to me, do you want to hear an interesting statistic? I said, yeah, what do you got? He said, there are more adult diapers sold in the U.S. than pediatric.
Wow.
Let's soak in a little bit. When I first heard that,
no pun intended, right?
Yeah. And so I said, are you sure? And now I'm kind of surreptitiously Googling on my iPhone while I am on the Zoom with him. And sure enough, there are more adult diapers sold in the US than pediatric. And when you do the math behind that, there's about 3.5 million babies born each year in the US, which means one of those populations is women who just gave birth. And a lot of them, so figure 3 million of them are going to have a problem for a while. Add on to that, women who, let's say they're athletic, they're weightlifters. A lot of them will have an issue with leaking. Add on to that the menopausal women and men and the geriatric population. And typically with the older population, baby's going to be in diapers for a year, 2 years. Older population, typically once they start, they're going to continue. Stimpod is phenomenal treating incontinence. And unlike traditional therapy where they send you out for pelvic floor work, which most people absolutely hate, we solve the incontinence issue at your ankle. You have all of your clothes on, just take off your socks and your shoes. And so we've got a lot of clinics who we've got a little banner. I don't have it right here with me, but actually, you know what? I'm going to find the banner and I'm going to show it to you. I tell them, put this little banner in your waiting room and as a little experiment and watch what happens. So imagine if in your waiting room you had this, you had this little banner.
Yep.
Right? What happens is I tell them, I said, as soon as your patient gets in the back, it might not be the first question that comes up, but it's probably going to be the second. And again, like we talked about before, don't just think about the patient, because they may not be asking for them. They may have a daughter who just had a baby. They may have a parent who's experiencing a problem. So think beyond just the patient. Think of the universe of who your patient knows that is also suffering with, whether it's incontinence, whether it's frozen shoulder, whether it's tennis elbow or pickleball elbow or neuropathy or abdominal pain, anything that's nerve related, we can help. And a lot of times the treatment itself is twice a week until resolved. There are some of the more chronic conditions like the diabetic neuropathy. At the workshop, you're actually selling them a package, and the neuropathy package consists of, it's an 8-week protocol where they're coming in twice a week for 8 weeks. We've got a lot of clinics who live in parts of the country where the wintertime, there can be snow and ice, and that neuropathy population, they're already a full risk. They already have mobility issues. For some of them, the ability to get to your office twice a week in December and January or February or March can be difficult. So the ability for you to let them take one of your Stimpods home with them for 6 weeks to be able to do the treatment at home, not only is a real convenience, typically they're going to get an even better outcome doing it 6 weeks at home than 8 weeks in your office, mostly because they're able to do vagal stim twice a day instead of twice a week. And we also will show them how to offer financing for their patients, because most of the time they're selling this package depending on where they are in the country and, you know, what their practice is like and the demographics of their area. Typically, they're selling the diabetic neuropathy program somewhere between $2,500 and $5,500. And the ability to offer some patient financing can really help. I tell the story that car dealers learned a long time ago that if somebody had to write you a check for 40 grand to buy a car, you're not going to sell all that many cars. But when you can offer that same car for $299 a month, bingo. So same thing, when a practice can offer consumer financing without having to be the bank. You know, no, you'll get all of your money day one, and finance company is going to do the billing and charge the patient. And the companies that we use, there's no recourse. If they accept that patient, they accept that patient, they pay you, there's no recourse back to you.
That's great. That's amazing. And so, Stan, where's the best place to get in touch with you to get started with this if someone wants to do this with you?
Stimpod10.com. And we too offer great financing, usually for most clinics, not all, you know, but most clinics that have fairly good credit, we can typically get zero down, zero payments for the first 60 or 90 days to give you some runway so you can actually start banking money before your first payment even comes due. But the fact is, most clinics start with either a 5-pack or a 10-pack of Stimpods, and they absolutely crush it because we get them trained. We show them how to do it. We show them how to talk about it, how to sell the package to their patients, and we encourage them, do case stories, okay? Make some great videos about these patients, because especially incontinence, one of the great markets are the young postpartum moms, and you're not treating them for incontinence now. They don't know you have anything at all to help them with that. But once you treat one of them, they typically are incredibly socially connected. They're going to be telling all their friends about it. Same thing happens with, the older population. When you're helping them, they tell everybody they know about it. So do the typical things that you've been teaching people to do, come up with, these case stories, come up with the way of telling stories, because people love to buy, but they hate to be sold. So we help people buy. That's the name of the game.
Awesome. Put a link to all of that in the show notes. Stan, thank you so much for talking to us about, adding cash-based strategies to a practice. I really appreciate it.
Yeah, they don't want to be relying on the insurance companies or Medicare for 100% of their revenue, because we see what happens every day. That gets more and more challenging. You want to be in charge of the revenue coming in. And can every patient afford it? No. You know what? But there's plenty of patients who can. And they know, for instance, if they want facelift, insurance isn't paying for that. They're going to write a check. So if they are ready to help their problem, they're going to pay you cash to help their problem, and you're going to help it. And then they're going to tell the world.
That's fantastic. Yeah. And collect more case stories. All right. Well, Stan, thank you so much. We'll make sure to check out Stimpods, stimpodted.com, number 10. And thank you all for taking Stan and I on your journey. This has been Eye and Garlic and the Garlic Marketing Show.